Well, welcome to Fitness Friday. This is Mike Keenan from KM Fitness. I'm here this morning with my guest, Dr. Tony Garrow. How are you this morning, Doctor? Good to see you. Tony grew up in New Jersey. He attended Montclair State University for his undergraduate and then attended Life University down in Atlanta, Georgia?
Yep.
Down in Georgia, and graduated in 1999. Dr. Tony opened his practice in Wall, New Jersey in 2000, where he offers not just chiropractic treatment, but also acupuncture, physical therapy, and massage therapy. And he also told me that recently he has a physician's assistant who works out of his office to provide general medical practices, including blood work, MRIs, and dealing with chronic pain issues. Well, thank you, Dr. Tony, for agreeing to be our guest this week.
Thanks for having me.
It's always a pleasure.
Yeah, it's always great.
Dr. Tony and I have been friends for about 15 years now, so I've seen him do a lot of great work, and he's worked on me. He's the only one who touches my neck, so it's one good thing. But today we want to focus our talk a little bit more about a common problem we both deal with, and that's sleep. Sleep as it relates to falling asleep, staying asleep, and just a good quality of sleep in general. Dr. Tony, tell me a little bit about your experiences with sleep with some of your clients.
Our number one cause of sleep issues is actually poor sleep habits.
Okay.
And the second most common is either medical conditions or pain-related issues. So that's the second most common reason for sleep issues. So the majority of my patients who come in here with back pain or neck pain, they don't get good sleep,
right,
especially initially when they're in the acute phase of the active pain. And so that's a major issue. And if they can't sleep, the healing process is not going to kick in. It's critical to healing and pain relief, and so that's a major problem that we have with our patients as they first come in.
Right.
And we don't want them taking more medicine on top of anything else they might be taking for pain relief or whatever is going on, anti-inflammatory. So the last thing we want them to do is take more pain medication.
Absolutely. No, I agree with everything you've said. I've experienced, and Dr. Tony has treated me many times, especially with some of my neck issues, and just trying to find a comfortable place to sleep. And then the constant waking, you move in bed and you wake up, and we both understand that we want to treat the root cause, and it's not a lack of ibuprofen in your diet. What are some of the things you discover as you go through the evaluation process, whether it be X-rays or hands-on evaluation? What are some of the things that you're seeing that are easily correctable in your practice?
Well, so most patients when they come in, we do a detailed history and then an examination, orthopedic test, some neurological tests. Then we a lot of times take X-rays if that's necessary, and then we can home in on the structural problems that are leading to whatever symptomatic issues they're having. And so we oftentimes will find muscle spasms, inflammation, spinal misalignments, nerve pressure, and then these are the things that are going to lead to muscle spasms, aches, and pains during the night. So you're trying to get comfortable, you fall asleep, the spasms can sometimes get even worse at night, or the inflammation because you're not moving.
Right.
And then you wake up, maybe you have to use the restroom, and you try to turn to your side and you get a shock pain, or you get muscle spasm, and it's very difficult to get back to sleep at that point. So that's how that all kind of leads into sleep issues. And now, just as an example, I had a lady who's had sleeping problems for almost 20 years, and she came in with major neck problems about 2 weeks ago. And after we got her out of that neck pain and spasms, out of the blue, she's sleeping better after 20 years. And the only thing she changed was chiropractic and physical therapy care at our office. She implemented that, and all of a sudden she's sleeping better. So her body's relaxing now, and her nervous system's functioning better, which is going to help her hormonally, and it's going to help her body just function better, but relax and able to get better sleep. So she's more happy about sleeping better than actually getting out of pain at this point.
Right.
So that's how chiropractic can help. And we're a big proponent of supplements too, of course.
Right. So what's something you might recommend? I mean, full disclosure here, Dr. Tony and I are both involved with ID Life. And tell me a little bit about your experiences with some of the supplements that you have used and what your clients are telling you.
Well, so I personally take the recommended supplements through ID Life from my health assessment that I took, and some of those supplements actually do help you sleep because you're taking supplements in the morning and afternoon or evening, and the evening ones are geared towards not keeping you awake but also helping you sleep. And some of them actually are geared towards stress relief and pain relief.
Yes.
So those supplements are going to help you with what we're talking about. But then they also have another one called sleep strips, which last week in my office we gave everybody a free sample of that, and now they're coming in and buying some because the sleep strips have supplements in them that help you fall asleep and stay asleep. So now if you're getting pain relief from chiropractic and physical therapy or acupuncture in our office, muscles are relaxing, your nervous system's functioning better because of the pressure off of that from getting chiropractic care. And then you take a supplement that you've never taken before, and it helps your body ease into sleep better and stay asleep. Now your body's going to have that, let's say, 6 to 8 hours to recuperate, heal, and just start to function better. And almost every single condition that there is known to man improves with better sleep.
Oh, absolutely. One of the things that we've talked about is that the biggest amount of human growth hormone occurs or secretion occurs while you're sleeping, and that is a tissue repair hormone. So I find when Dr. Tony's treated me in the past, and he's given me that adjustment that I needed to realign my spine, it now allows me to find a comfortable position in which I can rest that maybe I couldn't get into because I had a malalignment and I just couldn't find a comfortable position. But now that that's been relieved, it certainly allows me to rest, and then I can relax and I can fall asleep and stay asleep without always waking up. The other thing that I'll mention too is that a lot of times I don't feel the fix, if I can use that term, until about 12 to 14 hours later. So I may leave the office saying, yeah, I still feel a little stiff, but all of a sudden the adjustment works and the muscles relax and I feel much better, 12 to 14 hours later, as opposed to right at that moment. So don't be, I guess you have to remind people of that too.
Well, another thing is education is a strong point of our office, and so we even try to help people sleep in the best sleep position. So I get people, they come in, they say, my neck's killing me, what's the best pillow? And I try to explain to them, it's probably not your pillow, it's probably the position you're sleeping in. It's years of issues with your neck that haven't been addressed, and poor sleep habits. So the best positions to sleep on is either on your back with a medium pillow or on your side with a pillow that will basically caress your head and the space between your shoulder and your neck. But you do not want to sleep on your stomach. And unfortunately, when you sleep face down, your neck's got to turn to the side, and gravity sits on your lower back, and it's not supposed to be that. So you want to sleep on your side with a pillow between your knees if you can, and you want to or sleep on your back. And it's actually good to switch between those. If you can sleep on your back, turn on your side, maybe use the restroom, get up, turn on the other side. Now you're moving positions through the night, not getting too stuck in one position. So it's not a bad pillow, it's not a bad mattress or a bad bed most of the time. It's more bad positioning, bad habits. When I say bad habits, that's watching TV in bed, looking at your phone and scrolling through Facebook and trying to go to bed. It's too much light in the room. It could be a temperature issue in the room.
That's true. How about noise?
Noise is a huge factor, so I use a sound machine or a
Yep.
fan in our bedroom.
White noise.
Yeah, and like I said, when I brought up the temperature, a lot of people like to snuggle up with a bunch of covers, but most research says you want it to be a little bit on the cooler side.
I agree.
So these, you know, these are healthy habits, and it's the routine. So you can't go to bed at 12:45 a.m. one night, and then 10:45 the next night, and then back to 1 a.m. Like, it has to be regulated. So you try to go to bed between, say, 10 and 11, wake up between 6 and 8, and even 1 more hour of sleep, just one per night, has a significant effect on your overall health. I mean, you're 1 more hour of sleep per day can add possibly 5 more years of life. And
I agree.
and I saw something the other day, I just couldn't believe it, that almost half of our life is sleeping. So maybe a third to a half. So if you live to 60 years old, 20 years of your life was sleeping. 20 years of your life.
And you're going to have more life and more abundant life if you sleep well,
Yeah,
so
absolutely.
that, you know. Well, Dr. Tony, I want to thank you so much for being our guest today. You gave us a tremendous amount of information. I am coming back because there are other topics related to chiropractic and health that we haven't even had the time to touch on.
Absolutely.
Dr. Tony, tell us how people can find you, where your location.
Well, we're on the Jersey Shore. We're in Seagirt, Wall Township area, in the Food Town Plaza on Highway 35. And we do usually free consultations so that people can come in and feel comfortable about our office, learn about what we do. No obligation, just sit and talk to one of the doctors. I have another chiropractor that works with us, and so you get an opportunity to do that, and we find out if you're a fit for here. You can call us 732-223-1990. You can go to our website, which is garrowwellnesscenter.com, and just look us up on Facebook, obviously. If you can look up Tony Garrow or Garrow Wellness Center. And so many ways to find us. We have great reviews on Google, so you can actually see our real patients that have filled those out. And I think these days people need to look for information and education, and I don't mind if someone comes in for a consultation and never actually takes up care. Maybe they'll find something out about someone else they can refer here.
Absolutely.
And so, to me, I like to meet people and help people, and that's our message.
I think the next generation, Tony and I both have kids who are in college. This generation is not looking for the next quick fix. They want to be well, they want to be healthy, they want quality of life, and they want, I know, and I've witnessed it here myself, this is not come in, get a treatment and walk out. There's a lot of client education going on here, a lot of caring, a lot of listening, and I think that is so critical in today's medical practice, that you have a physician who's willing to listen to you to identify what exactly your needs are. Well, thanks again for having me, and we'll see you next week with another special guest. Take care.